This episode is brought to you by Bumble. So, you want to find someone you're compatible with, specifically someone who's ready for a serious connection, totally open to having kids in the future, is a tall, rock-climbing Libra, and loves rom-coms with vegan pizzas on Tuesdays just as much as you do. Bumble knows that you know exactly what's right for you. So whatever it is you're looking for, Bumble's features can help you find it. Date now on Bumble.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello, Jess.
All right, so today we are going to talk about animal bites. The clock is ticking, so let's get to it. All right, Dina, the weather is getting nicer. Kids are going outside more. I imagine that you're probably getting more and more calls about animal bites. So let's talk about it. How common are animal bites?
So they're not uncommon, and we do get a fair amount of calls about kids being bitten by an animal. And about 1% of all injury-related ER visits in the U.S. are due to animal bites. Dog bites, of course, are the most common, followed by cat bites. And boys also, maybe not a big surprise there, are more likely to be bitten than females by an animal. And kids often sustain bites pretty frequently. Children are more often to get bitten on the head and the neck because they're smaller, and that's what, they're bending down to touch the animal. And also, of course, more likely to get bitten on their hands.
So aside from the obvious that we don't want our child to be bitten by an animal, why do we worry about animal bites?
So we worry because a bite is full of germs from the mouth of an animal. So cultures of animal bites often contain many bacteria, including nasty bugs like staph or strep, which are common bacteria found in the mouth, but also bugs called Moraxella, Neisseria, and Pasteurella canis for dog bites, and Pasteurella multilocida for cat bites. And as a child is more at risk of becoming infected if they are immune compromised, things like cancer, or if the bite causes a deep puncture wound, they're more likely to get infected. A bite's more likely to get infected if it's on the hand or the foot, or you're more likely to get infected if you wait longer to get it treated. So if your child gets bitten by an animal, please reach out to your pediatrician right away to prevent that infection.
All right, so you said that dog bites are most common. So how do you manage those types of bites?
Dog bites tend to be, for the most part, a lower risk of infection than the other animal bites. However, major bites affecting joints may need more serious treatment, including IV antibiotics. So first things first, you want to make sure your child's tetanus shot is up to date, or if they need one, speak to your pediatrician on this. You want to make sure that the wound is cleaned thoroughly. Deeper wounds may need evaluation of underlying structures, such as nerves, tendons, and bones. Some smaller wounds can be left open to heal, but a suture may be needed if it's a gaping wound, but of course it needs to be done after carefully cleaning it by a professional. You also need to take antibiotics to prevent any infection in certain instances, such as if you are immune compromised, again, if things like diabetes, or if your child has cancer or on immune suppressive drugs. Often, when the wound needs stitches, you also need antibiotics. If it's a deep puncture wound, or if the wound is on the hand, face, foot, genital region, or showing signs of infection. The first line of treatment we usually use is Augmentin, which is, a very common antibiotic that we use.
What about cat bites?
So cat bites represent around 10% of animal bites, but they're more likely to get infected because the puncture wounds from cats make it more difficult to wash out the bacteria, and cat teeth are sharp and can do a good amount of damage to the skin. In fact, up to 50% of cat bites become infected. So again, with a cat bite, the first things first, you want to make sure your child's tetanus is up to date. You, especially with a cat bite, want to make sure that the wound is irrigated and flushed out well. You want to dress the wound with gauze and a small amount of topical antibiotic cream, like a Neosporin or bacitracin. And like dog bites, antibiotics are needed for kids that are immune compromised, when the wound needs stitches, when the wound is deep, or is on the hand, foot, face, genital region, or showing signs of infection. And the antibiotics used are generally the same as for dog bites, with Augmentin as one of the first antibiotics that we use.
All right, Dina. So a little birdie told me that you have a fear of bats, and I'm chuckling a little bit, not chuckling, but I live in the woods of Western Massachusetts, and we see bats all the time. So let's talk about that.
Well, I'll meet you in the city for our next date, because bat is my nightmare. I'm definitely afraid of bats, because literally the scenario is on every medical exam that I've ever taken, because it could be fatal. And the common thing is that, rabies is caused by an RNA virus that is transmitted through the saliva of rabid animals, so usually through a bite. So it enters your blood and then your central nervous system and causes an encephalomyelitis that is almost always fatal. And most cases of rabies in the U.S. are now from wild animals, such as raccoons, skunks, foxes, and the bat. So your local health department can guide you what to do there. So if you're exposed to a bat, the bat should be safely collected and submitted for testing for rabies, which is not going to happen with me. So I will not be hunting for your bats. So unless the bat is available for testing and is negative, post-exposure rabies prophylaxis is recommended for all persons with bites, scratches, or mucous membrane exposure to bats. Or even the classic question that we get asked on tests is, even if you wake up in a room with a bat and you're not sure if the bat bit you, we would tell you go to the ER for an evaluation and prophylaxis with rabies shots, which honestly is not fun since human rabies vaccine is given IM in the deltoid on days 0, 3, 7, and 14. So it's a process. So best to avoid them.
All right. Thanks, Dina. New fear unlocked. All right. Last question. What is the specific recommendation for the tetanus shot with bites?
So bites are obviously considered dirty, and therefore that's why you need to make sure your tetanus is up to date. So tetanus vaccine should be given to patients that have not completed the tetanus vaccine series, or it's greater than 5 years has elapsed since the last dose. And tetanus immunoglobulin should be given if less than 3 tetanus immunizations have been received.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, U.S. versus China, where I'll take you behind the scenes in the tumultuous U.S.-China relationship. Find Face Off wherever you get your podcasts.